Welcome, I'm Vicky Awalt. Today I'm here to discuss an overview of health policy issues related to medical home model, accountable care organizations, quality incentive care organizations, medical errors, and opioid issues. Medical home model is a process that provides comprehensive primary care for patients of all ages. This model is also known as Coordination of Care Patient-Centered Medical Home, PCMH. The PCMH aims to meet patient needs by providing coordination of care, enhancing quality, and reducing costs. This model relies on a team of providers to boost the delivery of preventative services, and it improves care coordination with patients who have complex chronic disease management needs. Policy issues with this model are summarized in two challenges. Number one, ensuring that the patient come to the PCMH first requires high level of education, engagement, and satisfaction with the healthcare provider. Number two, creating a robust health IT infrastructure requires significant financial investment and a strong buy-in from the leadership and clinical staff. Accountable care organizations are booming as a solution to the cost crisis in American health care, and it already involves 31 million patients. ACOs hold clinicians, group practices, and most times hospitals financially accountable for reducing expenditures and improving their patient health outcomes. Challenges: overcoming incentives for ACOs to engage in limiting and denial of care and taking of too much financial risk. Collecting meaningful data that captures quality and enables rewarding quality improvements of not just volume reduction. Creating incentives for ACOs that do not accept much risk to engage in prevention of health promotion. Creating effective governance and IT structures that are patient-centered and integrate care. Quality incentive programs. Healthcare is seen as entering an age in which both quality and efficiency are paramount in the purchase and delivery of healthcare. Taken together, the dual goals of quality and efficiency lead to a key concept: pay for performance, also known as value-based purchasing. Pay for performance initiatives have been suggested to improve the quality of patient care and provide incentive to improve providers' performance. The Center for Medicare and Medicaid Services has endorsed such programs to improve quality of care. The State of Quality Initiative, endorsed by CMS, in which institutions, providers, groups, and physicians are awarded incentive based on adherence to Medicare standards. In simple terms, the top-performing hospitals receive benefits from Medicare and Medicaid services for meeting the requirements set forth by Medicare and Medicaid. The underperforming hospitals were not given anything and penalized financially by the same governing board. Medical errors. A few of the most common type of medical errors includes medication errors including anesthesia, hospital-acquired infections, miss of delayed diagnosis that delayed treatment, inaccurate follow-up after treatment, inaccurate monitoring after a procedure, failure to add on test results, failure to take proper precautions, technical medical errors. Medical error challenges studied the medical errors policies issues has shown that medical issues are caused by healthcare provider workload fatigue, failure to coordinate, communicate, and collaborate, misunderstanding and miscommunication of policies, and lack of proper systems. Opioid issues. Prescription drugs monitoring programs, PDMPs, require time for management. Typically, patients with opioid diseases require extra time for coordination of care. Policy issues in regards to opioids. Inaccurate time and resources available for the physician and patients, relying on general impressions of risk for opioid misuse, viewing opioid monitoring as a law enforcement activity. Physicians work in the setting of policing, reporting, and punishing patients at times. In summary, solving health policy issues requires healthcare team integration approach. There is a lot of work ahead to solving health policy issues in the United States. I hope that you have enjoyed this presentation, and big thank you to all.